Welcome to the RocketPD Podcast. I'm your host, Corey Murray. I'm a longtime education journalist and co-founder of RocketPD, here to bring you real talk with educators confronting what's broken in America's schools and hopefully offering up some advice and solutions about how to help fix it. Whether you're out to engage families, center students in their learning, or empower teachers and staff, we're going to cover the gamut, giving you ideas and frameworks that you can start using today. So what do you say? Are you ready to launch? Then let's get into it.
Across the country, superintendents, school leadership, school boards, etc., we all agree on sort of what is the definition of absenteeism, chronic absenteeism, what are the numbers, but the numbers were really profound.
On this episode of the RocketPD Podcast, I sit down with Dr. Adrianna Bravo, pediatrician, school health expert, and chief medical officer for Inspire Health for Education. Together, we explore how student health, mental health, and access to care are silently driving absenteeism and lost instructional time across K-12 schools.
Before the pandemic, about 16%. This is just nationally speaking. Of course, this varies by district. At the peak of the pandemic and sort of in the year or so following that peak, that nearly doubled to like 31%. Drawing
from my own personal story and Inspire's proven impact in districts like LA Unified, where return to class rates jumped from 61% to 90% in a recent pilot.
There are districts, many public school districts across the country who have really taken the bull by the horn there and tried to wrestle with those numbers.
We attempt to reframe school-based healthcare as a critical lever for equity, well-being, and student learning. This one was near and dear to my heart. I hope you'll stick around to hear more. Hey, so Adrianna, it's great to have you. I was really excited for this conversation because, I'm someone with cerebral palsy. I know a lot of people who listen to this podcast probably know my story by now, but I'm someone with cerebral palsy, and I went to schools in Howard County, Maryland, public school system, and I had a tremendous school experience, and a lot of it was because of the support that I had around me. In particular, there was a woman named Miss Betsy. I used to call her Miss Betsy. And Miss Betsy would come to my class and she would pull me out of class 2 or 3 times a week for some extra support. Things that she would do would be some physical therapy, some occupational therapy, but we would talk about things like, how do I approach a problem I'm having, whether that's something that other kids might not think about, like going up and down the steps to school, right? Or carrying my book bag in a way that would be easier for me once I had the books in it. Different things like that some kids might take for granted, that I couldn't because of my physical situation. And those types of things, those types of activities, that type of thinking really created space for me to not have to worry about those things when I was in class and in school or going to school, so that I could focus on my learning. And I know that kids that have medical challenges at home or with them as they come to school, face that, where it's like, I don't necessarily have the headspace to think about my education, and that makes it more difficult for me. So I was excited to have this conversation because this is something that's near and dear to my heart. And I know that it's something that you're working on at Inspire. And I know that you've said before, it's kind of like, we're in this issue. It's a crisis in a lot of ways with what's going on with youth health and academic challenges. We hear all the time about the connection between health and academic success. Can you tell me a little bit about what you're learning and seeing?
Well, first of all, Corey, thank you so much. It's so good. And I love that story about what Miss Betsy did for you. I mean, it's just a great example of sort of back then. I won't ask you how old you are, so I won't say when that was, but back then, right? You as an individual had what many might say were complex medical issues, right? Or health issues that had the potential to negatively impact your academic experience, but they did not, or that impact was mitigated because you had regular, reliable, trustworthy, excellent access to the care that you needed, so that your school experience, academic and just functioning in the school environment, like you mentioned, your backpack and such, those resources accessible to you were a really vital bridge for you to be able to have your academic experience, and not just sort of survive it, but thrive in that academic experience. So I love that story. And you're right. That's exactly what we're trying to do here at Inspire. We recognized, I think like a lot of people did, many years ago, certainly before the pandemic, noticing that the complexity and the volume of health needs by young people, children and adolescents, school age individuals, their health needs were growing, not only in number, but in complexity. And we started to really see that happening.
Yeah, that's really cool to hear you say it. We talked about this thing, COVID, that happened, right? And that was a pandemic, right? And then for the most part, it's the COVID pandemic is over. But it's opened our eyes, as you said, to this sort of systemic problem that we've had in schools, which was that kids don't necessarily have access to the supports that they need in order to focus on their academics. And I know one big area where this comes out in the numbers, at least from what I've heard in talking to educators, is in absenteeism. The number of days that kids miss because of health-related challenges that, they're not even able to get into school to get to the academics that they might need to be successful. Let's talk for a second about absenteeism and the link between student health and that chronic absenteeism that so many schools are struggling with right now.
The numbers were really profound. Before the pandemic, about 16%. This is just nationally speaking. Of course, this varies by district. At the peak of the pandemic and sort of in the year or so following that peak, that nearly doubled to like 30, 31%, depending on, where you were in the country. So nationally speaking, there are districts, many public school districts across the country who have really taken the bull by the horn there and tried to wrestle with those numbers. And when we look at absenteeism, there's all kinds of reasons for absenteeism. And again, I think the COVID, the pandemic, really sort of, poured a lot of fuel on that fire. And some of it's still kind of hanging around and smoldering, right? But when you start to really look, and there's so many great organizations out there that are taking really hard looks at absenteeism, and some really, there's several states in this country that are really doing amazing work. And I don't know if we have time to get into all that detail, but really doing amazing work at trying to sort of whittle down those numbers and get kids back in the classroom, increase that in-person instructional time, right? But one of the reasons that I think is, I don't want to say often overlooked, but it's not the sort of marquee reason when people think of absenteeism in schools. They forget sometimes to think about health. And health, in this case, it always means sort of a lot, but in this case, it should mean a lot. There's a lot that you have to think about when you say, well, health and absenteeism. We're thinking about mental health, of course. We're thinking about the health of the school health staff themselves, the health of the employees of the school, of course, the health of the students, the medical and physical health of those students. But then we also have to think about, in that bucket of health and absenteeism, we have to think about some of these more sort of, kind of these social determinants of health, right? Things like, demographics, geographics, access to care, the sort of the ability of parents to be able to tend to their kids' health during sort of the academic day, whereas, they may be working 2 or 3 jobs and not have the ability to pick their kid up from school when that school nurse gives them a call and says, hey, Devin has a little bit of a fever. How can you pick him up today? That may not be possible anymore. So we've had this sort of, I would say social shift. I'm not a sociologist, but a social shift in how we think about care, how we access care, and what resources we sort of put under that umbrella of health care and health services. And when you put all of that together, there's a lot that can negatively impact absenteeism. And so again, that's kind of what Inspire's looking at. How do we dig into those specifics, and what can we look at to really improve health, improve access to health, make that access equitable, convenient, reliable, high quality? And if we can do that, then we start to see kids being able to be in school and increase that instructional learning time.
It's so interesting. As you're talking about this, I'm thinking about a school system which has all of these different stressors on it, right? It could be budget, it could be staffing, it could be, again, family engagement and quality of family life at home. But when you think about sort of the underpinning of all of this, right, to your point, it could come back to health, quality of health, whether it be mental or physical, and access to care, because that care, at least as I'm hearing you say it, can relieve stressors in so many different areas that might contribute to something like chronic absenteeism. The chronic absenteeism really is a symptom, if you're in medical terms, right, a symptom of a larger problem. In order to relieve the symptom, you've got to make the diagnoses. And, what is that diagnosis? That's fascinating to think about. Can you tell me a little bit about why do you think it is that schools often overlook health, student health in particular, family health in particular, as, a lever for change when we talk about relieving some of that stress?
Yeah. And I think I want to be careful I don't want to sort of imply that there's some blame to schools, right? I mean, I think, as we all know, schools, as you mentioned, have so many variables on their plate to sort of have their school communities operate, thrive, function well, serve the needs of, oftentimes very diverse groups. And those categories of diversity kind of include everything, right? So schools have a lot on their plates. And, up until some point, I mean, if we were really, sort of diving into a research paper, we would be able to pinpoint the era or the point. But up to some point, the school nurse typically was able to sort of handle the volume and complexity of what was going on there. And that we have our school nurse's office, it's stocked with some of the basics. If the school nurse sees a kid and, it's beyond kind of the scope of what they're able to help with, they call the parent and have the parent get, the kid sent home. And that kid could then go access the care that they need out in their community. But each of those pieces along the way has shifted. So the complexity and volume of needs of the students has shifted. The ability for the typical school nurse, and even let's put in the school counselor in this group too for the mental health piece, the sort of scope of what they're able to sort of address during that 8 to 3 or 8 to 4 o'clock, the school hours, that has shifted as well. And it sort of blows wide open this notion that if a kid's got a sniffle at school, we can help them. Maybe not. And I think it's hard for schools to sort of make that shift. They're educators. They're not there to understand health insurance and complexities of healthcare delivery systems. And that's not what schools should be worrying about, right? They need to be worried about education, educating kids. And so we have this sort of collision of schools trying to do their best and focus on education. Health and healthcare has totally shifted and changed. And so who fixes that for the kids while they're at school? And it's hard to say, well, the school should fix that. Well, should they? They're educators, Right. So I think we have to grow sort of this partnership. I talk to so many school nurses and school counselors across the country in all kinds of school settings, large public schools, small public schools, urban, suburban, rural, super rural, private schools, boarding schools, day school. I mean, all types of schools I work with. And it's fascinating to me across the board. You ask your typical school counselor, your typical school nurse, what has changed the most in the last, let's say, call it 10 years, pandemic or no pandemic, just in 10 years, what has changed? And they'll tell you, we went from seeing, 6, 7, 8, maybe 10 or 12 kids a day to now 50, 60 kids a day coming through that school health office in a matter of, maybe 6 or 7 hours of the school day. Even take away the lunch break, right, of that poor school health staff. That's coming down to 8 or 10 an hour. That's on the par with what a pediatrician or a nurse practitioner out in a really busy community practice is seeing. And now we're expecting all of that kind of care and that pace to sort of hold steady and to meet the demand. And then you add on top of that something that I am constantly hearing, again, from school nurses and also from the counselors and the mental health staff, is that complexity. So it's not just the volume has increased, but the complexity.
I mean, it sounds like a perfect storm of things coming together. You've got this model for healthcare that was designed, essentially, to your point, for a different time.
Yes.
All of these new complexities, all of this new data and information, all of these specialties and these different things that have come together to create a ton of stress on the system and a
Yes.
lot of complexity for nursing professionals in the school space that now need to know more and do more. Can we talk a little bit, because it's a fascinating topic for so many reasons, and I know that you've been doing some really interesting work at Inspire, and really the whole idea is to rethink the system so that we can start to deliver care in a more effective and responsible way to meet the needs of students and families inside schools, where we can give access and we can kind of control access to make sure that certain needs are met so that students can, spend more time learning. So I know you've done some work in LA, you've done some work in different places across the country. I would just love to hear a little bit about how that work is going. It's such a complex challenge, but at the core of it, it really is a simple idea, which is if we can deliver this care in a more efficient and effective way to kind of clear some space for students and families to focus on learning, they can do better in school. So tell me about that idea.
Yeah, I mean, and you said it just right. I mean, there's so many good studies out there that say the simple, which we inherently know that, but the studies sort of help us validate that healthy kids and kids that are healthy and have access to the care they need when they need it are able to learn better. They have better test scores. They stay in school longer. They have less absenteeism. I mean, there's so many parameters that have been sort of borne out in the research. So to us at Inspire, it kind of makes sense, right? That if we know that healthy kids learn better and their absenteeism can be reduced, if they're healthy, then they can be in school. And school is where they spend the vast majority of their time, at least certainly Monday through Fridays, right? Then why wouldn't we center the care of these kids inside of schools? Now, again, I don't think we're saying, well, let's ask the schools to do this, but we come in and develop a partnership with the schools. We know health, you know education. Let's marry those two together to the benefit of not only the kids, but the benefit of the staff and to the school community's well-being as a whole. And let's marry those two together and center the care inside of schools. So one of the things that I love to talk about, and I will definitely talk about Los Angeles. You mentioned our work there, and it's something that we're super proud of. But one of the things that I love to talk about is just sort of what our mission is. It's so simple and straightforward, and it kind of makes sense, Corey. This isn't rocket science, right? But let's center the care inside of the schools. Let's put the care where the kids are, so that we can equalize the access to high quality, convenient healthcare for kids. Let's not make them jump through hoops or leave school or wrestle with, trying to get an appointment or anything like that. Let's equalize the access so that everybody, regardless of whatever parameter you're looking at, everybody can access the care equally. Let's focus on reducing the school absenteeism. So if we can keep kids in school and get them healthy enough to be in school or get them to school rather than staying home, waiting a day or two to see the pediatrician, let's get them to school. Let's help them with that access and get them back into the classroom. While we're doing that, let's build a model and a program that ultimately at its core addresses resource shortages. If there's shortages of resources, let's put those resources in the school so that when people think my kid is sick or I'm not feeling well or I have a student that's struggling, we're not trying to look outside the school community to find the resources, maybe not, but let's put those resources in the school so that it's a natural thought of my kid's in need, there's a health issue with this particular student. Okay, the school in its partnership has those resources. So centering things inside of schools. And then ultimately the last piece of it is sort of the output is promoting well-being, and not just the well-being for those students, of course, but well-being for the employees and the staff and for the entire school community as a whole. So I love talking about that. And that's precisely what we did at Los Angeles Unified
That's
School
super
District.
cool. As you're saying this, you use the word partnership, which I think is so interesting because you said earlier, we shouldn't expect the schools to take healthcare and sort of run with it.
Right.
But if we could find a partnership where we know kids are going to be in school, we know parents are going to be on campus, this seems like a natural place to be able to offer access to these things so that we can accomplish the goal of school, which is learning. I love that idea. And I'd love to hear a little bit about the work that you're doing. Somebody threw a stat to me before our conversation. It said that return to class rates went from 61% to 90% after you started this work in this pilot that you did in LA Unified. So I'd love to hear a little bit about what you think really contributed to that change and why it happened so quickly in this case, because that's, it's a community everyone knows. It's a very large, very complex school community. And some would say, gosh, if you can do this there, you probably could do it in other places as well.
Yes. If you could do it here, you could do it anywhere, right? New York, New York.
Yeah.
That's a song, I think, from a Broadway show, right? But you're right. So 3 years ago, we did a pilot, and let me highlight a few pieces of this. One of the things that we're most proud of, and it is sort of a hallmark of how we work, even with other districts, is that we really we achieve it. We really customize what we're doing. So we always start with a period of discovery where we know that not every district, and maybe even inside of a district, not every school is the same. And there's all kinds of differences in terms of resources, staffing, geographic, there's so many things. So we start with a really careful sort of discovery period where we embed ourselves for a period of time to just learn and look and listen. Like, what is the current state? How does that school nurses or school counselor's office in an LAUSD's example, we'll talk about the school health office with the school nurses, because that's where that program was focused, or is focused, I should say. So we really take a look at what is the current state? How does it work now? And then we imagine and design a future state of what would the ideal be. And then in a partnership, we build that bridge from current state to future state. And that's exactly what we did in Los Angeles. And we noticed a couple of things. We noticed that kids who were coming to the school nurse's office were being addressed by these wonderful school nurses, but they often had to wait a long time, such that they may walk away, or that nurse would see them, but not really be able to fully help them because they were under-resourced in terms of, do I have some Advil on hand, or do I have, I have Band-Aids and ice pack, but what if I need something more than that? Do I have access to those resources? And a lot of times it was, no, we don't. So what kind of resources did they have? We look at things like, okay, when that parent is called to pick up the kid from school, why? Did the parent really need to come pick up that kid? Or is there something that we could do to allow that kid to see the nurse and go back to class rather than going home? And then we looked at very carefully for those kids that do go home, how quickly do they come back? Are they back later that day? Do they come back to school the next day? Does it sometimes take 2 or 3 days? Why does it take a couple of days? And we noticed that they were having trouble accessing care. They were having trouble getting the parent to get the appointment, or the parent couldn't take off work to get the appointment. So then they had to hold the kid out of school until they could get the appointment to get the doctor's note to come back to school. So we really looked at all of the different pieces that were contributing to what we felt, I don't want to say broken, because I think that diminishes the amazing work those school nurses were doing, but there certainly was lots of room for improvement, right? So we looked at that. We designed a model. We implemented that model in a pilot with, I think it was 9 schools, 3 school years ago. And it was, like you said, almost immediate that we started to see that improvement. And by the end of that pilot, which ran for sort of the spring semester, by the end of that pilot, we had really good data that showed for the kid that came to the school nurse's office and did not utilize or did not access the services that we were providing in partnership with the school nurses, they were being sent home and missing valuable instructional time about 91% of the time. And just in that very quick couple of months of a pilot, we were able to say, but if that kid came to the school nurse's office and was able to access the resources and the supports that we put in place there in partnership with those the existing school nurses, we could get those kids back into class 61, or not missing class only 61% of the time, right? So we were able to reduce absenteeism dramatically in a very quick period of time. So let me tell you what it was, because it's not crazy complex. It makes a lot of sense, and it's really compatible with the existing staff that was there. So we put in place, we gave every one of the pilot schools a sort of a tablet device, like an iPad or a Zebra tablet, something like that. They got a device. They got some quick training, super easy and kind of easy. So they had the device. We also, and I'll tell you about kind of how that worked and what that did. We also were able to consent in multiple languages and in multiple ways to sort of reach families, able to consent students and families to receive services, not in the moment that their kid was sick, but actually in advance. So sign up and say, yes, if my kid goes to the school nurse's office and that school nurse determines that, geez, I'd like some extra help with this situation, I have some resources. Can your kid use those resources? Is that okay for the school nurse to access those resources? So we pre-consented them, and they only had to sign it once. And then it was good for that whole school year. In that case of the pilot, it was good for the whole pilot period, right? So the kid may use our resources, 3 times a week or every day, maybe 3 times in one day. That kid would come to the school nurse, or they may not use it at all. But we did this pre-consent, so everything was kind of ready and easy and smooth in the event their kid was sick and went to the school nurse's office. And then the third piece was what we call our care box. And this is something that we're super proud of, but in essence, Corey, it's a giant tackle box. It's a huge, enormous tackle box. And inside of it is everything you can imagine that might be in your medicine cabinet at home or in a CVS or a Walgreens, all kinds of over-the-counter things. And even, in some cases, in certain cases, even some like starter doses of common prescription medications, the amoxicillin for a sore throat or an ear infection, things like that. And so essentially what happens is a kid comes to the school nurse's office. They have whatever complaint they have. Maybe they come right in the morning because they woke up feeling ill and the parents said, well, get to school because there's help there. And then maybe you'll actually be able to go to class rather than sitting at home waiting for the pediatrician or somebody to, or me to be able to take you to the urgent care. So the kid sees the school nurse for whatever the issue is. The school nurse makes whatever assessment they do. Might be brief and quick. They might know right away they need extra help. It might take a little time. Whatever the school nurse, we don't want to sort of step in front of them. We want to empower and augment and partner in their work. We're not trying to replace the work of those valuable school nurses. But that school nurse at whatever point in the first 15 seconds or maybe 10 or 20 minutes later, at whatever point that school nurse says, you know what, I want to access these resources. They pick up that tablet device, a couple of really quick clicks of the button, and within minutes, and typically under 1 minute, you have a doctor, a pediatrician, or a nurse practitioner on the screen. Really quick wait time, so it's on demand. It can be scheduled if you want, but the on-demand is right there. We hop onto the screen. One of our providers, all of our providers have, the kind of experience you would hope that they would have. Telehealth experience, school experience, pediatric and adolescent experience. They're really sort of, subject matter experts, if you will, in taking care of kids and, with common ailments in schools and over telehealth. They conduct their visit over telehealth with the student on one side of the screen, our provider on the other side of the screen. What's really awesome is if the student, the school nurse, or the provider, and if at any point someone's like, really would like to include the parent on this, we can click a button and scoop that parent right into the call too if they want, but they don't have to. We have their permission to see their kid if they're not available, but the parents can always join in if they like, and it's really easy to do that. And then Once our providers have made a quick assessment of what's going on, the rash looks like this, or the stomach ache is probably due to this, or the headache needs this kind of attention. Once they determine what's going on, they say to the school nurse, hey, open up that care box. I'm going to go ahead and give you permission and kind of a verbal order, and then we'll follow it up with an order in writing that gets emailed to the nurse. Here's, go ahead and open that up and you can give this kid the 2 Advils. We will also send an automatic message to the parent to say, hey, your kid was seen by us today on telehealth with the school nurse. We gave 2 Advils. Here's some things to check on when this kid gets home from school. If you have any questions, here's how you can reach us. So really looping those parents in, making sure that that kid has quick, easy access to what they need, and supporting that school nurse who's super busy and just needs an extra set of hands and needs those resources and supplies at the ready. So all of that sort of happens. And most of the time, those kids then get what they need and can head on back to class. And it's really wonderful. And so that's where those numbers come from. How many kids we have been able to send back to class without having to send them home.
It's like, there's this thing that happens where once a kid goes home, you don't really know if and when you're going to get them back, right? But if you can keep them in school longer by delivering care, you can make sure that that care is delivered in a responsible and a sort of a high fidelity way with the permissions and the things that you mentioned, so that the parent feels good about whatever permissions they've given. The school is very clear about what they will and they won't do, and that there's a medical professional who's signing off on the delivery of that care to that student, all inside that office, essentially with the help of that telehealth piece or that kiosk that you provide to them. You really can see where, that breakdown, which happens when kids leave school, kind of closes and allows those kids to stay. That's super cool. I actually wrote down a couple things, like one, and you kind of mentioned one of them already, which was, I wrote down like liability, right? So, you've got healthcare professionals who are directing these nurses about what to deliver, and then that starts to make a lot of sense. They're creating the order, they're giving the verbal permission. And so it's happening right there in the office, as opposed to going to the pediatrician's office, however long that might take, having that done, and then eventually coming back to school. The other thing I wrote down, which I want to ask you about, is insurance. I know that people talk a lot about the skyrocketing cost of healthcare, and particularly insurance. So how does a student's or a family's, personal health insurance play into the delivery of some of these things? And are some students able to access them because they have different levels of insurance versus others? And how do you deal with that?
Let me just say a couple of things there. The first and foremost that I think is just foundational to the work we do, and it kind of goes back to that mission, those 4 points of our mission, is that we really make sure that access is equitable and that it is regardless of a student's ability to pay. So yes, for students that do have commercial or private insurance, we absolutely take that information at that point of consent, and we will bill for insurance to the insurance provider and seek reimbursement. Depending on the school district, depending on sort of lots of variables, we typically don't have any co-pays. There's typically not any balance billing. We sort of just whatever the insurance covers, it covers. For those individuals with government-funded insurance, so the Medicaid students and that sort of thing, same thing. All of our providers are credentialed to be able to accept Medicaid and bill for Medicaid. So all of those students, and if we have a student who's eligible for Medicaid, but for whatever reason hasn't yet enrolled, we work with the school to be able to support that student getting enrolled in Medicaid. But that's not something that would stop them from being able to be seen. Well, you don't have Medicaid yet. It's a 3-month process to get it, but come back in 3 months. No. We'll go ahead and see that student. So that having that equitable access for all students, regardless of the ability to pay, is really important. But what about those kids that don't have insurance or who are grossly underinsured or just have no insurance at all? Same thing. We pride ourselves in working with districts, having partnerships in the local communities, grants, that kind of work, support from nonprofits and community partnerships to be able to have the funding to help those students that are underinsured.
Really interesting. Yeah, that equitable piece is so important. And I know oftentimes it just so happens that the kids who have access to, less insurance, don't have access to healthcare outside of school are probably oftentimes the ones who need it the most in school. And so finding a way to bridge that gap so that all students, regardless of their insured status, can have access to that care when they need it is so critical. And I know working in a district like LAUSD is an example, you get a lot of students from a lot of different walks and a lot of different situations. And so it's great to hear that you're trying to bridge that gap and you're having some success. Speaking of bridging gaps, we talked a lot about physical ailments, right? We talked a lot about if your kid is sick and they need medicine, things that are, fairly easily diagnosable by a healthcare provider, online. But then there are other things, and I know a lot of school districts are challenged with, particularly the mental health crisis that we're seeing in schools. There are more mental health needs in schools than ever, and everyone that we speak to asks this question. They talk about the pressure that mental health and the need for mental health support is putting on students, is putting on teachers, is putting on that system that we talked about that wasn't necessarily designed for this. Pre-COVID, some of these things weren't talked about as much. Post-COVID, a lot of these things have become really visible in our system, and that tax on our system, that pressure on our system has become so obvious. How do you work with districts on and educators and school nurses on the mental health side?
Yeah, you said it. There is, nobody's arguing this. There is a youth mental health crisis, absolutely. And there are a number of states out there that are at the sort of highest level in the state, addressing this with legislation and multi-pronged initiatives and directing funding to be able to support this. But ultimately, and there's improvements being made, but ultimately what is still existing right now is just a drastically increased number of students that need support. And as we were talking about with the medical issues, it's not only that increase in volume, but the complexity of the needs or the chronicity of the needs, mental health needs of students is just, it's sort of exploded, if you will, particularly since, the peak of the pandemic. So how do we deal with that? Well, it's a different model, but let me just say it's very similar as well. So telehealth is an amazing tool, right? So if at one point, or kind of one of the roots of the problem is that there's just not enough counselors out in the community. There's not enough psychologists, psychiatrists. I can't get an appointment. My insurance doesn't cover it. I'm really rural environment and I have to travel an hour to find somebody who can see me. And I can't see them for 5 weeks because they don't have any room in their schedule. And so what is my depressed or anxious kid supposed to do during those weeks? The problems are immense, right? So same sort of concept that we talked about. If let's go ahead and center that care inside of schools, make families able to access the care they need from inside the school. Let's use telehealth as an amazing tool to be able to do that. And what that allows us on our side is, okay, yes, we may have, a team of 70 psychologists or mental health providers, but they don't all have to be right there in, rural Texas or rural Tennessee or rural Colorado or wherever it is, right? We could have our providers who are seated in California or New York or Massachusetts be able to help those students in those rural areas and do it in a way that is minimizing how much time they're missing school, and it's targeted and tailored to their specific needs. One of the biggest differences, though, that I think is really important, and something that we're really excited about doing, and we're just beginning to roll this out, for example, in Virginia, statewide, is having that telehealth not be only on demand the way that medical telehealth is, right? but having it be heavily geared towards appointments and scheduling and those repetitive visits for that student that has the more chronic need. I need to see my counselor twice a week for 8 weeks or once a week for 12 weeks. We've got to, it's great to have the on-demand care when those crises or kind of sub-crises types of moments are happening, but the real sort of meat on the bones in addressing mental health needs of students is being able to have mental health that's accessible and repeatable over time, right? And the building those relationships with your provider is really, really critical in successfully managing the mental health needs of students and youth and adolescents.
That's phenomenal. You've taken it all the way back to that first piece, right, which is the academic success of the student and how quality care can support that ultimate goal, at least for the school, which is to have a student who's happy, healthy, and learning to their fullest potential. I wrote down a couple of things. I think it's so interesting, right? It's like you have this matching system, right? You're matching students to the care that they need. You're delivering that care in a way that respects, depending on the type of care, the relationship required in order for that care to be successful. And then you are providing opportunities to maximize the potential of that care by ensuring that those kids not only come to that first appointment or that second appointment, but that they continue to come until that care is maximized and that return is maximized both for the student and then hopefully at the end of the rainbow for the school, because that kid stays in school and that kid learns better and performs better in school. That's phenomenal. And I think just so interesting. It's such a complex thing, but you've taken it and you've boiled it down, I think, to these things that really matter at the end of the day and kind of think about where do we provide these supports in order to enable that to happen. So I love that story. I think it's awesome. And I think if, we have a lot of superintendents, we have a lot of educators in both, the academic space and the health space who listen to this podcast. And, if you were to if they were leaning into this and saying, gosh, this has been a problem for us for years, we've been trying to think about how to address it, where would you recommend that they start, Adrianna?
Yeah, that's a good question. I mean, quite simply, I would say, let's just have a conversation, right? I mean, to kind of go quickly back to LA, we did that pilot, and I don't think we mentioned in our conversation so far, we did that pilot, saw those results super quickly. And next thing you know, in year 2, then we went to an expansion. We moved from pilot to several hundred schools. And now this year we're in our 3rd school year with them, which is our 2nd year of the expansion off of the pilot. And we're on track to sort of be in close to 400 schools just in LA, and tweaking and calibrating and sort of scaling, but tweaking and calibrating along the way so that we're really customized and we're meeting that school and those students and families where they are, solving and being creative in that solving and partnered in that solution making, so that what's there, that healthcare that does get centered in the school, is not just sort of generic, but it's really touching at exactly what that district or that school needs.
I love this idea because every student is different. Every family is different. There are so many different needs. This notion that, rather than jumping 2 feet in and doing everything at once, right? Getting into the fabric of that particular school system, that community, understanding specific needs, and then kind of growing out from there. And that really does speak to this whole notion of, this is less a delivery mechanism and more a relationship mechanism, understanding how the healthcare providers can work with the school system to create that relationship that benefits the students and families, as opposed to simply delivering a service for the sake of delivering that service and, applying for Medicaid or Medicare reimbursement, whatever it might be. So I think that's phenomenal. I think it takes us all the way back to the beginning, which is, my story with Miss Betsy and the fact that I was able to establish a relationship with someone over time who really helped me understand my needs and differences. And as a result of that, I was able to free up space in my own head and my own mind to focus on school. I love love the idea that Inspire is helping kind of do that at scale in some of these communities that need it now more than ever. So thank you for sharing your story with us today. I'm hopeful that others will hear this and be interested in that story. If you are interested in the work that Inspire is doing, I'll put a link down below the podcast so you can look at it there. You can also reach out to us at RocketPD.com. We'll have some more information about Inspire's work and their story. Dr. Bravo, I just want to thank you again. This has been phenomenal. I love this type of conversation. I particularly loved this conversation because of what it means to me. So thank you. I hope we'll get a chance to talk again really soon.
Oh, thank you, Corey. It's been my pleasure. I really enjoyed it. Thank you so much.
Thanks, Adrianna. Take care. Thanks for listening to this episode of the RocketPD Podcast. I'm your host, Corey Murray. We hope you found today's conversation insightful. If you enjoyed what you heard, consider clicking that like button and subscribing to our channel. You can download the RocketPD Podcast wherever you find your favorite pods. We're also on YouTube. Just search for RocketPD. At RocketPD, we're on a mission to empower the world's teachers and staff. To learn more about our work and the community we're building together, visit us anytime at RocketPD.com. If you're an educator and you're listening to this, remember, your work matters. So be well, do right, and let's keep up the fight.